Hi, it's Dr. Centeno, and this is a continuation of the CCI symptom series. And today we're going to get into what causes brain fog in CCI patients. So I'm out for 6 weeks, but getting new content out each week. And this will be the usual same bat time, same bat channel, both on Facebook Live and on YouTube Live. And I will be putting this out each week on Friday at 1 p.m. I've got 5 of those 6 weeks covered, so you'll have new content for most of the time that I'm gone. So many CCI patients report brain fog and other cognitive issues. These are symptoms in a word map format of patients with CCI, and as you can see, cognitive issues and brain fog right in there with things like neck pain, fatigue, GI symptoms, and the like. Now, there are many theories about what causes the symptom of brain fog, but let's start by defining it. So brain fog, symptoms such as confusion, forgetfulness, difficulty concentrating, feeling mentally sluggish, having a lack of mental clarity. People experiencing brain fog might find it challenging, for example, to think clearly, focus on tasks, or remember information. And common brain fog causes that need to be ruled out: stress, lack of restful sleep, hormonal changes such as menopause and andropause, a diet that's high in carbs and sugars, medications, and other medical conditions. So there's lots of causes of brain fog, and obviously if we're going to attribute brain fog to your neck, then we've got to rule out these other things. So there are some potential brain fog causes in CCI patients, like neural inflammation, vagus nerve problems, and the role of eye saccades in information retrieval. So let's get into some of these. Neuroinflammation, the concept here is a cervical medullary syndrome in ME/CFS patients, where you've got the dens, and you can see the arrow there, that goes too far back, and especially in flexion, the dens can irritate the brainstem there. It's also believed that the vagus nerve can play a role here. Remember that the vagus nerve can get irritated in front of C1 or C2, and that rotation in C1 and C2 can irritate the vagus nerve. Now realize that the vagus nerve, when it's irritated, can put you into that fight or flight response. And when you're in that fight or flight response, that's not the place where you're going to be thinking clearly. That's more reacting than thinking through a complex problem. So that's one of the ways that the vagus nerve may be responsible for some of these brain fog symptoms. And then finally, interestingly, eye movements are involved in remembering. And this seems a little weird, but for example, this is how EMDR works. So if you remember something, you remember the eye pattern that you used when the event happened. And as you're remembering it, you repeat that eye pattern. Well, we know that the neck can cause problems with eye movement. And so if you have disturbed eye movement from a problem in your upper neck, then you're going to be having difficulty with the eye movements involved in remembering. So if your brain fog is due to CCI, then obviously fix the instability. That would be the first focus. And there's no Dr. C Q&A today, but feel free to interact and ask each other questions through the comment section. And I'll be returning on October 30th with more videos and Q&A sessions at that time. So Thanks so much for watching today, and have a great day.